recorded, that recording will be posted to the Division of Aging's website, and a link will be sent to you about a week before your compliance review actually starts so that you can review this recording closer to the date of your compliance review if that's something you want to do. I am joined today by several of my Division of Aging colleagues. We have Lauren Perry, who is the Director of Provider Relations, as well as Matt Nicholas and Christy McCann, who are both working on provider applications and provider compliance reviews as well. This meeting is taking place in webinar format, which means that we are not able to unmute or allow you all to come off camera, or on camera, I should say. So your cameras are off and your microphones are off. If you have a question during this presentation, please feel free to chat it into the chat box and we will answer all questions at the end of the presentation. With that, we'll go ahead and get started. It sounds like the dings have kind of slowed down a little bit, so we will go ahead and get started, and hopefully most everyone is here. So welcome everyone to the Provider Compliance Review informational webinar. We appreciate you all taking time out of your busy schedules to come and learn about the Provider Compliance Review process. So we'll start with what is Provider Compliance Review. So according to the HCBS Provider Manual, the Division of Aging conducts provider compliance reviews for all non-licensed waiver service providers, as well as licensed providers that offer services that fall outside the scope of their license. The provider compliance review includes a review of provider policies and adherence to state and federal requirements, as well as adherence to the provider's own policies. So I do want to make it very clear, this process is separate from your settings rule certification. If you are a site who has recently gone through the settings rule certification process, you do still need to come into compliance with provider compliance review. Those are two separate processes. It is also a separate process, but very similar process to your 5-year renewal that happens with OMPP and the IHCP programs. So again, it will be very similar to what you're used to seeing when you recertify or revalidate with OMPP and IHCP, but it is a different process. This one is conducted by the Division of Aging. So a provider compliance review is really looking at a couple of things. We are looking at a document review. We will be reviewing all of your policies and procedures, things like background checks and TB tests for your agents and staff. We will be ensuring two things. First of all, we will be ensuring that all of your policies and procedures are compliant with Indiana and federal law. And secondly, we will be ensuring that you are following those internal policies and procedures and that you are following Indiana and federal law. That's really what we're looking for in provider compliance reviews, is that everything is compliant with the laws and that you're following all of the policies and laws that you need to be following in order to provide these valuable services to vulnerable Hoosiers. So normally provider compliance reviews are required to happen every 3 years. However, because of the COVID public health emergency, or PHE, we paused the process of provider compliance reviews here in the Division of Aging. That means that we've not done them for the last 3 years, but that we have to start the process by November 11th. November 11th marks 6 months from the end of the public health emergency, and that is when all normal operations within Medicaid waiver services must restart. So all flexibilities from the Medicaid waiver services during the public health emergency have to end by November 11th, which means provider compliance reviews need to start by then. We anticipate that provider compliance reviews will start sometime in October. All providers who became Medicaid waiver providers in the year 2020 or before are due for their PCR this year. If you became a Medicaid waiver provider in the year 2021, 2022, or 2023, You are not required to complete a provider compliance review this year. Those reviews will be done in those 3-year cycles. However, if you became a provider before the year 2020 or in the year 2020, you are due for a provider compliance review this year. We'll discuss the timeline of document submission later on in this webinar, but I do want to note that there is a very quick turnaround required of all providers due to the sheer number of reviews and the need for the state to bring all providers into compliance. A provider compliance review really should take no more than 30 days from start to finish. And the state has 1,100 providers that we need to bring into compliance with our provider compliance review process. So our evaluators will be moving very quickly. There will be very little wiggle room for extensions or anything like that. We will consider possible extensions on extenuating circumstances only, but I'll talk about the timelines here in a minute. When we talk about these timelines, I really want to stress the fact that you should not be needing to create new documents. That's part of the reason these timelines should go so quickly. We are reviewing current policies and procedures. We are reviewing the documents that you already have in place. So there should not be a need to create new documents. That is what is so time consuming during the provider application process, is that you're creating new documents. That's not happening during the provider compliance review process, so it should be a much quicker and smoother process. All providers who became providers in 2020 or before are going to be required to go through the provider compliance review process. And I realize that this is different than what many of you may have experienced in the past. In the past, only unlicensed providers went through the provider compliance review process. Now, all providers, whether licensed or unlicensed, will be going through the provider compliance review process. The reason for this is that the Division of Aging requires information that is not gathered during your licensure process in order to be a provider. Therefore, we want to make sure that all providers, whether licensed or not, are compliant with Indiana and federal regulations. So again, I recognize that this is different than what you may have experienced in the past, but because of those differences between licensing requirements and provider requirements, we determined that it was necessary for all providers to go through this process, whether they are licensed or not. What does the actual provider compliance review process look like? You will receive a letter, and we are going to start with the providers who are furthest from the date of their last PCR process. So this is not happening in alphabetical order. This is not happening in any kind of punitive order or anything like that. We are going to start with the providers who have not gone through the PCR process in the longest period of time. You will receive an announcement letter. That announcement letter will say, hey, it's time for your provider compliance review, and will include a link to this webinar recording. At the same time as your announcement letter is sent to you, you will also receive a blank staff roster sent to you from your processor or your evaluator. That staff roster will need to be completed and returned within 5 business days. All staff and agents of your organization, whether they are direct service providers or not, whether they are staff or volunteers or contractors, whether they are administrative staff or direct care staff, whether they are providing Medicaid waiver services or private pay services, all staff and agents of your organization must be represented on that staff roster. That staff roster needs to be, as I said, returned within 5 business days of receipt of your announcement letter. Your processor will then receive that staff roster and highlight certain staff for whom they want to review employment records. They will send the staff roster back to you along with a document checklist within 5 business days of their receipt of your staff roster. So you send the staff roster into the state, and then within 5 business days, the state will send you a document checklist and a subsection of that staff roster that they are requesting employment records on. You then have 10 business days to send in those required documents. All of the documents on the checklist, as well as all of the employment records requested for the staff or agents of your agency, need to get sent into the state within 10 business days of the day you receive that information. Following that, the processor will review all of those documents for compliance. We anticipate that this will take between 5 and 10 business days. The processor will then issue a findings letter to your organization, very similar to an audit findings letter, where we say we notice that these things are out of compliance with Indiana code, or these things are out of compliance with federal regulation, or the processes that you're enacting don't follow the policies that you have written down, or whatever the case may be. You, as the provider, then have 5 business days to fix those findings. The processor will review those resubmitted documents and issue a compliance letter. All told, this entire process should not take more than about 30 business days. Again, we need to move very quickly through this process. We expect full compliance and cooperation of all of our providers in our network. And again, you are not recreating any policies, procedures, or documents. All of these things should already exist in your organization. Most of them were created when you became a provider of Medicaid waiver services. All we're doing is verifying that those still exist, that any revisions you may have made are in compliance with state and federal law, and that you're actually following the policies and procedures that you submitted to the state when you became a waiver provider. As I mentioned, all providers are required to participate in this process, whether or not you are licensed or unlicensed. The only providers who will not participate in this process this year are those who became providers in the years 2021, 2022, or 2023. You will, however, if you became a provider in one of those 3 years, go through that process, this exact same process, in the coming years. Failure to respond to your processor's emails and requests for information could result in corrective action plans. And the consequences of corrective action plans are up to and including termination of being able to bill for Medicaid waiver services. So, again, we are taking this very seriously. This is something that has to happen, that is written into our provider manual, that has to occur to make sure that all of our providers are providing quality care and following their own policies and procedures. A word about the findings document. So, very similar to any audit, the processor is going to issue a findings letter if there's anything that they discover during your provider compliance review that is either out of compliance with Indiana or federal law, or if they discover that you as an agency are not following your own policies. You will receive that findings letter outlining any documents that are incomplete or non-compliant and have 5 business days to fix those findings. If you send documents in and they are still not correct, or you fail to send them in within those 5 business days, your processor will issue a second findings letter. You will then have another 5 business days from the timing of that second findings letter to fix any further issues. So let's say your certificate of insurance has expired, and that's what's in the first findings letter. You have 5 business days to get a new certificate of insurance and send it to your processor. If you fail to do so, or if you do and the insurance is still not compliant with state and federal regulations, your processor will issue a second compliance letter. If the issues still fail to be addressed in that second compliance letter, 5 days after that second compliance letter is issued, your agency will be placed on a corrective action plan. So then let's talk about corrective action plans. There are a couple of situations where a corrective action plan may be issued. The first is if those findings in that findings letter are not addressed adequately within 5 business days of that second findings letter. The second type of corrective action plan is issued if you as a provider are non-communicative or non-compliant with the overall provider compliance review process. Again, we are moving quickly. We expect everyone to be compliant and communicative during this process, and we greatly appreciate your cooperation in this process. The consequences of being placed on a corrective action plan will vary, but they can go up to and include termination of the ability to provide Medicaid waiver services. If you as a provider are found to be not in compliance or you're issued this corrective action plan, and the ultimate consequence is that we remove the ability for you to bill Medicaid waiver services, you will have the option to appeal, and your right to appeal will be outlined in a letter that you receive. However, prior to taking action to suspend or terminate you as a provider, we will work very closely with you and with care managers to make sure that alternative service options are provided to anyone who you are serving. Our goal is not to disrupt services for any individuals on Medicaid waiver services right now, but we want to make sure that all of our providers are compliant with this process. So if your right to bill Medicaid is revoked, you will not be allowed to take on any new Medicaid waiver clients, and the clients that you have on your roster will be transferred to other agencies who are compliant with this process. I'm going to stop there and answer any questions that come in the chat. Feel free to chat in any questions that you may have. I will record for probably another 20 minutes to get kind of the most frequently asked questions, and then I will stop the recording so that the recording isn't ridiculously long when we post it to the website. So I'm going to go to the chat and scroll all the way up to the top, which is going to take me a minute. Again, feel free to chat in any questions, comments, concerns you might have about this process, and we will do our best to address them in the time we have remaining. Will this webinar be recorded and made available for later viewing? Yes, this webinar is being recorded and will be posted to the Division of Aging's website. You will receive a link to the webinar recording in your notification letter. So that will come 5 days before your staff roster is due. So you'll have a chance to rewatch it if you would like to. I will also post the slide deck to that same website so that you can review the slides if you would like to. Have a couple of people struggling with audio. I hope that you got that fixed. There's maybe 4 who said they were struggling with audio, so I hope the rest of you heard it. Um, it's working on my end, so I think it might be your speakers, unfortunately. Does staff roster also mean board of directors? That's a great question. Yes. Any staff, volunteer, contractor, or other agent of your agency, and a board of directors is usually volunteers. If it's a nonprofit organization, they can be paid if they are not a nonprofit organization, in which case they're probably a 1099 contractor. Um, those folks definitely need to be on the staff roster. Our agency received communication from our local agency on aging asking for the documents you are describing and called it a quality assurance review. Is this the same thing you are describing here? I'm not sure what the local AAA is doing. I honestly don't know and don't want to hazard a guess. I would ask the AAA what's happening and what they're doing. This is outlined, our process, I should say, is outlined in the provider manual and is a requirement of all providers. I don't know the AAA's what that process is. Do you have an estimate number or percentage of staff you will review? We will review 5 staff or 5% of your staff, whichever is less. 5 staff, or 5%, whichever is less. Please confirm the requirement for TB test. We have internal staff, including customer service, monitoring center, and office staff that does not have any face-to-face contact with the client. Due to them never going into the home and having no contact, do they have to have the TB test, or is that only for direct care workers who have face-to-face representatives, face-to-face contact with the clients? I'm going to ask Matt. Matt knows a little bit more about TB testing than I do. Matt Nicholas is on the provider relations team. Matt, do non-direct care staff need to have the TB test requirement?
Nope, it's only the TB required skin test done annually is only required for direct care staff, contractors, and so forth.
Great, thank you, Matt.
Yep.
Will these audit letters and all the communication happen via email with our reviewers so there's no delays with receiving this information back and forth for this audit? Yes, that is correct. All communication will happen via email. Um, if you are unable to email documents in, I know sometimes they get too long or there's concerns about emailing any kind of protected information from your staff members in or anything like that, you are welcome to postal mail. We, of course, will make sure that it is postmarked by the date that it is required. Obviously, if we don't receive it for another 2 days, that's not a ding against you if the post office is delayed in something like that. If I was the one that received the webinar sign up information for this meeting, is it assumed then that I would be the one who receives this audit information when it is sent out? Yes, that is correct. If you are the one who received this, that means you are named as the contact within the CAM system, and you will be the one who gets the initial communication. If you want someone else in your organization to receive the communication, then when you get the communication, please forward it to the correct person and put them in touch with the processor. Matt, I see your hand up. Go ahead.
Thank you, Stephanie. Just in regards to the confidential nature that they're worried about sending information through, that is a great question. And of course, we at the division value uh, confidentiality very highly, including HIPAA. And so they can, well, if they do not have the means to send something securely through email, by all means, they can request the Division of Aging to send the email message securely. We have a way to do that. I think it's only an extra step that they might have to go and use to log into our secure network. And then just as long as they follow that email stream or message, that should be able to send the email securely.
Great. So we can do email, secure email, or postal mail. Thank you, Matt.
Yeah.
Do you have a checklist of items included in this process? The checklist is different for every provider because it depends on the services that the provider is providing. You will be given a custom checklist during the process by your processor, and that's what you have 10 days to turn in. TB requirements changed, and we're only doing a TB risk assessment annually after the initial hire two-step TB test is done. Is this acceptable practice for you? We just clarified TB requirements with our Office of General Counsel this morning. The TB test does need to be done annually. Either a skin test or chest x-ray needs to be done annually. That is what's written in Division of Aging Indiana Administrative Code. I know that the Department of Health regulations have changed, and that's fine. They can do that, but our code still says that it needs to be done annually. When you say all staff, does that include staff that does not provide services to those on the A&D waiver? Yes. When I say all staff, I mean all staff, volunteers, contractors, and representatives of your organization on the date that you are notified of this procedure starting. Could we have your email address in case there are any follow-up questions or concerns? Sure thing. Christy or Matt, would one of you chat my email address in, please, so I can keep going on questions? Who will receive these notifications? Whoever is the primary contact listed in CAMS will receive the notification. That should be whoever received the notification to attend this webinar. Do all colleagues need background checks annually? No, we do not require annual background checks. Do all colleagues have to have annual TB tests? The TB questionnaire will not suffice. That is correct. Every direct care service worker has to have an annual TB test, either skin test or chest x-ray. How is employee confidentiality protected during all of this process with mailings? Again, you can either send things in a secure email to your processor, or if you're concerned, you can also postal mail things to us here at the Division of Aging. If you address it to provider relations, only those involved in this process will be looking at it. Employee roster, does that include previous employees or just current? Only current employees as of the date that you receive notification. Current employees, staff, volunteers, contractors, agents, etc. Should Livestream be included on our roster? No, Livestream is not working for you. They are their own company. They will go through their own process. We don't get a copy of this presentation until we receive our letter. That's when I will send you a direct link. You are welcome to peruse the Division of Aging's website, but we also don't want to bombard everyone with communication. We know that you get a ton of bulletins every day from the Division of Aging, from the Office of Medicaid Policy and Planning, from Indiana Healthcare Programs, from the Department of Health. We don't want to bombard you with just a link. You are welcome to reach out and I will give you a PDF of these slides, but the recording will be sent to you when you get your letter. What date is the review taking place? We will start the reviews in October, and we will start with the agencies for whom it has been the longest since they had a provider compliance review done. That means we might not get to some agencies until May of 2024, and that's okay. We'll get them when we get them, but we will start with the oldest ones. Just clarification, is the TB and physical a requirement for the A&D waiver and is CPR required? TB is a requirement for the A&D waiver. A physical is not a requirement for the A&D waiver. However, if you have it in your personnel policies that your staff have to have a physical, then we will be checking to make sure that you are following those policies. CPR is required for all direct care staff. And more information about all of this can be found in the waiver provider manual and in the Indiana aging rule. In reviewing the documents on the DA website, I see QA/QI addressed, but unclear as to the specific requirements for our own internal QA/QI requirements, frequency, etc. So whatever the Division of Aging says is the minimum requirement is what must be met. If you choose to go above and beyond that with your own internal documents, that's perfectly fine. But then we will be checking to make sure that you are following those processes. Is a one-step or two-step TB test required? The TB test is either required to be the skin test or a chest x-ray. Do owners of a company need to go on staff rosters? Yes. How is this different from the copper review in 2022? I'm not sure what the copper review is or was. That was, to my knowledge, not something that the Division of Aging did. So I can't speak to how this is different from that. Not sure if others have this problem, but staff turnover since COVID has been terrible. Is there any way to go ahead and send us a letter listing what we need to provide? I'm working most days as staff. That would help me immensely. Unfortunately, that's not possible. Your processor will send you the letter when it is time for you to do this. They have 1,100 of these to go through. We can't start sending checklists to people who aren't up for this yet. We experience a high turnover with staff. We updated the roster as we go. Do you have to add terminated staff back to the roster? No, only current staff, volunteers, and agents and contractors of your organization need to be on the roster. You spoke of the letter requesting a staff roster and the consequent letter requesting personnel records. Will that document checklist include the policies and providers being reviewed, or is there a second process for that? We will send you the staff roster and what we require for the 5 or 5% of your staff and your document checklist at the same time. Where and when can we receive this training information for future use? Again, this will be posted to the Division of Aging's website and also sent to you when you start your process. Do we need to retain employee files? We are no longer employed. That's up to your personnel policies. Most agencies that I have seen require employee personnel files to be maintained for 7 years. So that's really up to your internal policies. Is there a current provider compliance review worksheet available similar to this one that's posted on the FSSA website? There is not. We are not ready to release that. And again, it will look different for every type of service being provided. Are family caregivers participating in structured family caregiving considered staff? They are not employees or contractors. Yes, they are considered staff because we are paying them. So they might not be employees or contractors, but they are representatives of your organization who are being paid by your organization. Will the staff roster need to include all active staff or any staff ever employed by the home care agency, including former staff? Just current active staff as of the date of the notification of your provider compliance review. Can you provide a contact to change our email contact so we receive the notice? Matt or Christy, would one of you please chat in the provider app's email address so that they can change their contact in CAMS? Is mouth swab for drug required? No, the state does not require drug testing. However, if your internal documents require drug testing, we will ensure that you are following your internal documents. Are care managers considered direct staff? If you are a care manager agency, a AAA or an independent care management agency, yes, then care managers are considered direct care staff because they have direct contact with individuals. Uh, Several questions about things that we've already talked about. The waiver manual states attendant care cannot use Hoyer lifts, but there was an email in February this year stating attendant care can use Hoyer lifts. That is outside the scope of today's presentation. Please reach out to the Division of Aging uh, response email and somebody will research that and get back to you. What date will the emails start going out? We anticipate this process will start in early October. If your agency serves the DD waiver population, do you have to include that staff in the department also? Yes, all staff of your agency and contractors and volunteers and representatives must be included in the staff roster. Uh, does family caregivers require the TB test? Yes, they are direct care staff. Clarification on the TB annual testing. Is the questionnaire sufficient for annual testing? Then the skin test, if any signs or symptoms per new state TB requirements, or you will require a skin test annual. We will require either a skin test or a chest x-ray on an annual basis. I know that this is different from what the Department of Health requires. This, however, is what is in Indiana Aging Code. The provider reference manual refers to Indiana professional licensure search for findings for caregivers. Is this required for non-licensed staff? No, we will only be checking the professional licensure search for licensed staff. I thought a chest x-ray was good for 5 years. Is that not true anymore? I don't know if it is or is not true from a medical standpoint. From a state law standpoint, the law says every year. We are a fairly new agency, and when they left after our site visit, they said they would be back between 6 to 12 months. Is this a different process from the site visit? Yes, this is a different process. If you as an agency became a Medicaid waiver provider in the year 21, 22, or 23, you will not be going through this provider compliance review process. You will be going through the site visit process either for settings rule or for Office of Medicaid Planning and Policy. We outsource our billing, so they would not be included. That is correct. Your outsourced billing would not be included. I help my wife with IT. I do not get paid. Would I be considered part of the staff roster? Yes, because you are considered a volunteer the same way that a volunteer going into an assisted living is a volunteer. Um, Some things we've already answered. Once we receive the 5 people and/or 5% of staff, how far does the information requested go back for the client? We will ask for things related to those 5 people's employment. So for example, if you're providing transportation, we will ask for the driver's license of those people. If you are providing direct care, we will ask for the TB test of those people. It will be just dependent on the services that you are providing. You will complete a checklist for those 5 people or 5%. Does the TB test need to be a two-step or can we have a one-step? If you're doing a skin test, I believe it needs to be a two-step because that's how skin tests work. That does not mean that they have to do 2 tests. The 2 steps of a TB test are getting the injection and then reading the injection. Do caregivers need CPR? Yes, I believe that is accurate, but you can check the waiver manual to verify who needs CPR in terms of the standards. Let's see. I attended the first session of this webinar and have read the provider manual in full as well as reference codes. I cannot find info related to frequency of background checks. If our policy is to do checks upon hire and not annually, is this sufficient? First of all, thank you for doing your research. I really appreciate that. Anything that folks are asking, a lot of it can be found in the provider manual or in the codes. Um, we just heard from our attorneys this morning because we have sent this over to them a couple of times as well. We do require a background check on hire and not annually. Now, if your agency puts in their documents that you are doing annual background checks, then we're going to make sure that you're following that process. However, the minimum standard for the state is annual. Will the employee roster allow us to distinguish between direct care workers and administrative staff? That's a great question. Yes, we will ask for the role so you can put direct care worker or billing or IT or whatever. So yes, there is a place for that. Um, some questions I've already answered before. If we find in the audit that all employees do not have a TB, will we be able to correct that if they go within the 5 days? Yes. Are we able to drop the information off to the office? I would prefer no, just because I feel like we lose the chain of custody then. I think it's a little bit safer to go through the post office because then it ends up in the correct person's mailbox. And most of the people who are working on this process work virtually. So they're not in the office. So we will scan the information over to them. How often do staff background checks need to be completed? Staff background checks need to be completed upon hire and then whatever your policies say. Let's see, some stuff that's not within the scope of this presentation, and I would encourage you all to review the provider manual. Is this review completed for providers for the entire state or by each individual operation within the state for larger providers? That's a great question. We pulled each individual operation within CAMS to see which providers needed to go through this process. Family members working with their loved ones, yes, are required to have the annual TB testing. They are employees of your agency. Do they have to have CPR from the American Heart Association or can it be another company? The way the Indiana code is written is that it is either the American Heart Association, the Red Cross, or another approved company. So you can reach out to your processor and make sure that your company that you're using is approved, but it does not have to be the American Heart Association. Is blood draw acceptable instead of a two-step TB test? The Indiana code specifically says skin test or chest x-ray. So we are relying on the law to tell us what we need to do. Who are these other approved CPR companies? There's not a list of them. You just have to let us know who you're using. And frankly, as long as they're not like a fly by night, Joe's CPR or something like that, it'll be fine. Does this review also include case manager's quarterly notes? No, we are not reviewing case manager's quarterly notes. Will you be asking for employee training records? Yes, we will be. We will be asking to see employee training records to make sure that they understand your policies and that they're trained on all relevant Indiana and federal laws. Can you clarify TB tests and CPR for structured family caregivers? Yes, they're required. They are direct care staff who are being paid by your agency. They have to have annual TB tests and CPR certification. Some things I've already answered before. What are the specific requirements for the background check? Does it need to be limited criminal or something else? It has to be a limited state or national background check, same as the policy when you became a Medicaid waiver provider. What if we are authorized to perform services and are on the waiver but do not currently have any clients being served as of today, but we're hopeful to receive new clients in the future? That's a great question. You are still authorized to provide waiver services, so you will still be going through this process. Some things that are outside the scope of this conversation, I would encourage you to review the waiver and all associated communication. What is your definition of direct care? Employees that come face to face with a client is direct care. Matt and Christy answering a few questions. Thank you both for doing that. Uh, there is not a current provider compliance review worksheet online. We said that. There is a difference in one-step and two-step TB test. Can you clarify which one is needed? As long as it is a TB skin test, the Indiana State Code does not specify whether it needs to be a one-step or two-step TB test. So as long as it is a TB skin test or chest x-ray completed annually, that is what needs to happen. Would you please verify again in regards to those who were approved 2021 till date? Do we still get the physical visit from the state? You will not go through the provider compliance review process, but that does not mean you will not get other visits. I don't know what other processes might be happening from other state agencies like OMPP. If they are doing a physical site visit, then that is them. If you were approved in 21, 22, or 23, you will not go through this specific process that we are talking about today. When is the settings rule or policy review due? Those are two different things. Settings rule compliance is due every 3 years for 6 different types of providers. You will be in contact with the individual who will be doing your settings review. And I'm not sure what you mean by policy review. That's what we're talking about now with provider compliance review is a policy review. Let's see. Will you be able to differentiate the differences in requirements for employee records between A&D and DD waivers? We will be asking for the employee records for the people who we ask for, either 5 individuals or 5% of your staff, whichever is less, and making sure that they are compliant with A&D policies. If you have somebody only serving on disability waivers, make sure that that is noted in the staff roster that they are a direct care provider for DD waivers only or something like that. And we will make sure that they are compliant with those policies, not A&D policies. With the SFC program, do caregivers have to have a driver's license or does an ID count? That's a great question. As long as they are not transporting people, a state ID is perfectly fine. Obviously, we need a driver's license if we're transporting individuals, but if they're providing SFC in the home and not transporting anywhere, a state ID is perfectly fine. Um, Is Google Drive an acceptable format for storing employee and client files or documents, or does everything need to be printed for review? In terms of storage, that's up to your individual organization. In terms of transmission to the state, we will not be able to access a Google Drive. That is not something that we have access to. You will need to either email as attachments or print and scan. We do CPR in 2 steps, heel stream course, and live mannequin training in the house. Is this acceptable? That sounds fine to me. I don't know heel stream, but as long as they're, a reputable provider, that sounds fine. We've been doing 2-step TB, 2 tests approximately 2 weeks apart. Is this incorrect? No, that's fine, as long as it is a skin test or a chest X-ray. I should not have said driver's license. I apologize. We will be asking for driver's license or state ID. Only driver's licenses are required for those who are transporting, and then state IDs for other individuals. I apologize for that confusion. Christy or Matt, could you please post a link to the provider manual and the Indiana aging rule in the chat? There's a couple of requests for both of those things. Is the background check county or statewide? It needs to be either limited, state, or national. Are IOG and or my case state sufficient for background checks, as long as they are limited, state, or national background checks? I don't believe my case is. Matt's raising his hand and he knows more about this than I do, so I'm going to defer to him.
Thank you, Stephanie. So basically, what we need is either limited, national, or expanded background checks. Can be done by any third-party vendor. That being said, on those things, and sorry, Stephanie, I'm going to go off a little
You're fine.
subject here. Um, if you are doing limited, you must be sure that the service area that the limited background check is covering is the state of Indiana. If you get a limited background check from, for instance, the state of Florida, chances are it's going to be only for Florida. We need it to be for at least the state to cover the state of Indiana. Also, my case is not a background check. That is something else the state of Indiana does that can show criminal or court investigations and things like that. However, it is not a background check. Also, please note sheriff deputy report, criminal reports are not covering the whole state. They are only covering the counties that the sheriff's department oversees. So that would not be acceptable either. Uh, I think I covered everything, Stephanie. Is that right?
That sounds right to me,
All
Matt. I
right, thank
appreciate it.
you. Yep.
Yep. Are weekly entertainers included in this? For instance, a musical performer, a church pastor that does Bible study. Yes, those are volunteers of your organization, so they should be listed on your staff roster as a volunteer. Just be super specific in what their volunteer duties include. There's a place for their name and then their job title, I should say. Just be super clear what those are so we know that your musical performer, probably doesn't need to be CPR certified. Just be very, very clear in that. Uh, on the National Nurse Registry, we were told PSA would need this and to print a blank page and write name and date. Is this correct? Yes. So when you're looking up PSA licensures and you come up with no action taken against someone's license, it comes up with a blank page. Just go ahead and print and write your name and the date and sign it. Please, you as the owner or manager or something like that, be the one to sign it, because the challenge is if Joe Smith has an action taken against his PSA license and he is searching himself and he types in John Smith, it's going to show up a blank page. So it's really important that you as the manager search all of your people's names and not let them do it themselves. Is CPR needed for non-medical agency? Um, Matt, can you speak to that? I'm thinking especially things like homemaker and attendant care. I don't know offhand if CPR is required for those services.
Sure. So first of all, we have to be careful with how we talk about these services. Uh, the Division of Aging does not offer medical services per se. So we're always in that home care or home assistance, if you will, realm of things. And so when we're talking about CPR, that's all direct care service roles. That's your structured family caregiving caregiver. That is your attendant care personnel. That is your home and community assistants, formerly known as homemaker, direct service role, respite roles, and all of those other types of roles that are considered direct care. That's what is required for the annual, or I'm sorry, the CPR certification.
Thanks, Matt. Is quantiferon TB blood test not allowed? It is not allowed. I mean, you're welcome to do it, but it does not meet the state requirements. The state law says skin test or chest x-ray. Is there any exclusion for drug and alcohol abuse on a criminal background check? I would encourage you to read the Indiana code and ver can excuse me, orient yourself with the 9 convictions that are excluded from direct care work. There are 9 convictions that if anyone has any of those convictions, whether it is a felony or a misdemeanor, they are not allowed to be a direct service provider. I can't speak to drug and alcohol because I don't know all 9 and the levels and everything off the top of my head, so I would review the Indiana code. Uh, when doing the Indiana professional licensing check for potential caregivers, can we simply print off the query results or do we have to purchase the official PLA results report? You can just print off the query results. That's fine. I read the code as unlimited. Is that not correct? I assume that's referring to background checks. Background checks need to be either state, federal, or limited background checks. If there's a policy that I wanted to update before I'm up for review, can I only update that policy? You can update that policy. That's perfectly fine. Will transmission of employee and client files need to be done digitally via email, or will files be reviewed during an in-person compliance check? This entire process is virtual. We will not be doing any in-person checks for the provider compliance review process. We will also not be asking for any client files during the provider review process. Now, that doesn't mean that there aren't settings rule things happening and things with OMPP and things with Department of Health. So you might have to do an in-person check or an in-person visit with some other organization before provider compliance reviews. This will all be done virtually. Does office staff have to have a background check? Matt, please correct me if I'm wrong, but I am fairly certain background checks are done only on direct care staff.
Actually, background checks are needed for all
Oh,
staff, agents, and representatives. Where it comes to the direct service role only, that's where the 9 prohibited convictions come in. Say, for instance, if somebody unfortunately had a battery charge, they could not be a attendant care personnel because that's a direct service role. However, they could be involved in the bookkeeping process with no client interaction.
thanks, Matt. Thank you for correcting me. I appreciate it. Our organization employs those for skilled nursing and childcare, as well as for our home health agency. Must we list all employees or those only providing care in our home health agency? You must list all employees of the entire agency, the entire company. My job is aging in place waiver modification. Do we need CPR training? That is not direct care. That is not, I believe that CPR is not required for home mods. Matt, does that sound right to you?
You're correct.
Thank
Home
you.
modification is not a direct care position.
Is this compliance review in addition to the Medicare and Medicaid DHHS survey? I assume so. I don't know what that is. That sounds like something from OMPP, and all agencies through which you're licensed are going to be doing different reviews and different compliance with you. Some things we've already answered. There are links to my email address and the waiver manual in the chat if you scroll through the chat. CPR for care managers, I'm going to have to do a little more research if CPR is required for care managers or not. I'm not sure, and I don't want to give you wrong information, so let me do a little bit more research into that. Where do we find the Indiana code for the 9 convictions? Matt or Christy, could you please put the Indiana code in the chat? Let's see, some things we've already answered. Can agencies be notified of their selection for provider compliance review both via mail and email? You previously mentioned being notified via mail only. It will be via email only. I'm sorry if that wasn't clear. This entire process will be done virtually. You have the option to mail things into the Division of Aging offices if you would like to, but we will send the notification to you via email. Clarification on the skilled nursing child care question. Does the fact that they are all separate licenses play a part? No, they are. It is still the same company. We are verifying that your entire company is in compliance, and part of that is making sure that all staff are in compliance. Now, again, on the staff roster, be very clear about their role and say child care provider or skilled nursing provider or something like that. And we will most likely not select those staff to check their requirements. So just be very clear on that staff roster where the job title is. If staff had something on the background that prohibited them for the position but was dismissed, can we use this staff member? Yes, if it is dismissed or discharged, that is fine. Our company has a branch in Florida. Do they need to be on the staff list? Matt, what do you think about that one? It's still part of the same company, but I also understand that some of these assisted living companies have branches all over the country. Matt may have jumped off. Let me do a little bit of research into
Oh,
that. Oh, there's Matt.
oh, sorry, Stephanie. I was actually going to say the same thing, just to make
Yeah,
sure we've got all our ducks in a row and whatnot.
yeah. Meredith, if you could email me that question so that I don't lose it and I can send it to our office of general counsel, that would be great. Getting a lot of questions about care managers. I'm going to do some more research into that. Do contractors need TB tests? If they are providing direct care to the staff, they definitely do. Matt, do people need TB tests if they are not direct care workers?
They do not need TB test if they do not have a direct care role.
Great, thank you. If the office staff is virtual and works from another state, what state should the background check be in? That's a great question. Indiana State Code requires Indiana State, Limited, or National. Therefore, it would be Indiana if you're just doing a state-run check. However, you might consider doing a federal background check in that case, just to make sure that all of your bases are covered. If staff are licensed as an LCSW or MSW, but it is not a requirement of their role, such as a care manager, will you be checking their licensure? Lynn, if you could send me that in an email, I am not sure about the answer to that, and I'm going to need to do a little bit more research. Lots of questions about TB tests. It has to be a skin test or chest x-ray, and it has to be done annually. That is what the Indiana code requires. Again, I realize this is different from Department of Health regulations. I realize it might be different from CDC recommendations. That is what is required in Indiana codes. Yes, the slides for this presentation will be posted on the waiver website. They will also be sent to you in an email when it is time for you to start your process. Home modification contractor or assessment final exam does not need a TB test. That is correct. You are not a direct care worker, so you do not need a TB test. Can you post the link for the code for TB testing? Matt, could you post the link for the Indiana code, please? Do waiver caregivers need HHA license? It depends on what services they're providing, what licenses they need. I would refer to the provider manual and see what the requirements are for the types of services that you're providing. How do we verify the issuer of employees' CPR certificates? It should be on the certificate, who issued it. Will the whole recording of this be available to listen to the part that I missed? Yes, it will be available. Training requirements, where do we find those? All requirements are in the waiver manual. You can review the manual for the services that you are providing and see what the requirements are for those services. Matt, thank you for posting the 9 prohibited convictions. It is 455 IAC 2-15-2. You can just type those numbers and letters into a Google search and it will come up. Again, that's 455 IAC 2-15-2. All right, the questions have slowed down tremendously. I will stay on for another 4 minutes in case there are any additional questions. So I will stay on until 10 after 11 to answer any additional questions that you have. You may also email me. Christy put my email in the chat above. You can email me if you have any kind of one-off questions that you don't want to ask publicly but are unique to your organization or something like that. And again, the slides and recording will be posted and made available on the DA's website. TB skin test requirement is 455 IAC 2-14-1. Again, 455 IAC 2-14-1. The code comes up from the Cornell Law School. I think they were just the indexers of the code. As long as it's the Indiana Code on Aging, that's fine. Are you going to publicly release your response to the question about staff lists for companies with branches in other states? Yes, we will put together an FAQ sheet and post it along with this recording and the slides when we're able to post them online. My email is in the chat, but I will go ahead and drop it in again. So we need to track and make sure that the individuals that are paid to take care of their family member have an annual TB test and CPR. Yes, that is correct. They are direct care staff of your agency. They need to have TB test and CPR. Matt posted the Indiana aging rule. We will start doing all of this beginning of October. Yes, that is correct. We won't be coming out. This will all be virtual. But it will start in the beginning of October, again, with the agencies for whom it has been the longest. It might not be June until we get to your particular agency. It just kind of depends on how long everything takes with other agencies who have been longest since they had their PCR. So if I wasn't licensed until 2021, when will I have to go through this process? In theory, 2024, because it should be done every 3 years. However, I don't know what Medicaid is going to do when the waiver transitions, so I don't want to promise anything one way or another. Can you repeat how many employees will be reviewed, please? Either 5% or 5, whichever is less. Please clarify again about care managers and TB testing. I don't know. I will do more research and post it with the FAQs. If a background check comes back inconclusive, do we need to have caregivers get a fingerprint or can they do a local background check from the sheriff's office? Matt, what do you know about inconclusive background checks?
So I don't have them in front of me, but basically, in the verbiage of inconclusive, it requires the person to get fingerprinted, I believe. And so that would need to come from a entity that is doing national or expanded background check. I would fear that going to the sheriff's deputy's office to do the fingerprinting would then give only be checked for anything through those counties. So we still want to keep it at a state or national level, not the local sheriff's office.
Great, thanks, Matt. Question about policies. Yes, we will be asking to see your policies through this process. And the last question I'm going to answer live today is a question about waiver transition. What I mean by waiver transition is that waiver authority is moving from the Division of Aging to a combination of DDRS and OMPP. I would reach out to both of those entities to learn more about how the waiver transition is going to affect you. With that, I'm going to end the recording and end the webinar. If you have additional questions, please feel free to email me or wait for the FAQs to be posted or wait for your processor to begin the process with you. Thank you all so much for attending and have a great rest of your day.